Hi, I'm Dr. Sharky. I've been practicing medicine for nearly 20 years. The majority of that time is spent treating the most critically ill patients in intensive care. Over the years, we doctors have come to recognize what truly makes a difference when it comes to staying healthy and living longer. There's no shortage of health advice online, YouTubers and influencers offering tips on longevity, but most of them aren't medical professionals and don't deal with critically ill patients every day. Today, I want to share with you 3 factors we as doctors consistently monitor to improve our own health and longevity. The first one may not surprise you, but the third, it's something most doctors rarely discuss with patients, so stick around to the end. Number 3 is weight. No shocker here. Being overweight is harmful, but let me explain why your weight can directly affect your safety during a medical emergency. Carrying excess weight, especially around your abdomen, becomes particularly dangerous if you require urgent surgery or end up in intensive care. For example, when I have to administer emergency general anesthesia to an overweight patient, I must plan for a difficult airway. Securing your airway when you're unconscious becomes much riskier when you're overweight. Your lungs have less reserve, which means you can become hypoxic more quickly. There's also a greater risk of aspiration, which is vomiting while unconscious, which can send acidic stomach contents into your lungs, causing severe and potentially fatal damage. During the height of the COVID-19 pandemic, I saw many otherwise healthy individuals end up in a coma on ventilators simply because they were overweight. We could talk endlessly about the other health effects of excess weight, but regardless of how you measure it, BMI, body percentage, waist-hip ratio, we doctors are meticulous about maintaining a healthy weight ourselves. And with the advent of GLP-1 medications like Ozempic and Mounjaro, it's becoming more achievable than ever. Number 2 is exercise tolerance. I might get some pushback for sharing this, but it's critical you know. One of the most important indicators we look at when assessing a patient's ability to survive a serious illness is their exercise tolerance, or what we call their functional baseline. This refers to your usual level of physical activity. Can you handle daily tasks independently? How far can you walk before getting winded? Can you climb a flight of stairs without getting out of breath? These questions matter. Let's say you catch a severe chest infection, and that turns into a pneumonia. You're hospitalized and need respiratory support. If you're admitted to intensive care, one of the first things I'll assess is how physically resilient you are. Procedures like mechanical ventilation and medically induced comas are incredibly demanding on the body. If you're already physically frail, these interventions might do more harm than good, and in some cases result in prolonged suffering without any chance of recovery. On the other hand, if you're physically fit, someone who walks regularly, has good stamina, you're far more likely to survive and recover, even if you come out a little weaker than before. So yes, regular movement, cardiovascular fitness, and strength training aren't just about looking good. They could save your life one day. Before we get to number 1, if you're finding this video helpful, please subscribe to the channel and hit the like button so more people can benefit from this information. Number 1, CT coronary angiogram and coronary artery calcium score. Now for the one most doctors don't talk about, yet many of us are doing ourselves. A coronary calcium CT scan is a test that looks for calcium deposits in the arteries that supply blood to your heart. These deposits are early signs of atherosclerosis and can significantly increase your risk of a heart attack, even if you have no symptoms. Traditionally, we assess heart attack risk based on factors like diabetes, high cholesterol, and high blood pressure. But when I worked as a cardiothoracic anesthesiologist doing open heart surgeries, I started seeing more and more young patients, some in their 30s, come in for bypass operations. Yes, some had diabetes or a family history of heart disease, but some were seemingly healthy, even marathon runners, and yet they had dangerous blockages. The exact cause of plaque buildup aren't always well understood, which is why many of us doctors now choose to get these scans ourselves. A CT coronary angiogram provides detailed images of the coronary arteries, identifying blockages or narrowing. The calcium score tells us how much calcified plaque is present, offering a glimpse into our real risk of a heart attack. Now, this isn't a routine screening test for the general public, mainly due to cost, access, and radiation exposure. But for those with family history, risk factors, or just a peace of mind, many of us find it's well worth doing occasionally. I myself had one done a few years ago and plan to repeat it periodically. I hope you found this video helpful. Of course, there are many other things we doctors do behind the scenes to protect our health, many of which aren't common knowledge. If you'd like me to dive into more of these in future videos, drop a comment below and let me know. Stay healthy, stay safe.